So before we get started with this video, I want to make sure that we're all on the same page. So we're going to do a 5-minute rewind. And what I want you to do is to pause the video for a minute and I want you to define what is oxygen consumption. What is VO2? What are the typical maximum values for somebody who is sedentary or recreationally active or for our elite athletes? And can you know the difference between male and female? What is the Fick equation? This is a huge equation that we're going to come back and even talk about more today, but I want you to think, what is the Fick equation? And what is the difference between absolute versus relative VO2? So take a moment, pause the video, look over it, and decide, figure out what these different things are. Okay, so the Fick equation, VO2 equals our cardiac output times our content of oxygen in the arteries minus the content of oxygen in the veins, or the arterial venous difference. Okay, so we're going to talk about now in this video is how do these different components change as we move from rest to exercise? So remember, our cardiac output is heart rate times stroke volume. So let's take a look at how the heart rate and stroke volume can change when we move to exercise. Well, when we begin exercise, we have what's called a heart rate response that increases before we start exercising as an anticipatory response. So, in anticipation of us beginning to exercise, our bodies will adapt to be able to increase our heart rate, because in order to pump all the blood around to the rest of the body, we've got to be able to have an increase of heart rate to do that, to handle that metabolic demand. Think of it like, have you ever watched a kid who is about to go chase after somebody or run and go and get something? And they're like, okay, I'm going to go running. Ready? Okay, let's go. And they like psych themselves up before they actually start running. Little do we realize this is happening in our body every single time we move to do something that is going to increase our heart rate, that we will do it immediately before the actual exercise begins, in anticipation of needing to have our heart rate at a higher rate in order to deliver enough oxygen to all of the working tissues. So our heart rate increases in preparation for this exercise. And this is happening through the sympathetic nervous system, through transmitters that are called norepinephrine. And then also epinephrine, which is released as a hormone from the adrenal medulla, which is right above our kidneys. And these go to act on our beta 1 receptors, the epinephrine does. We don't necessarily have to go into that extent right now, but what I want you to understand is that we are doing this in anticipation of us being able to exercise. Now, the question is, how do we actually know that this is happening? We're going to get to that in just a minute. All right. So, at the onset of exercise, dynamic exercise, the first thing that happens is we've got our parasympathetic system and our sympathetic nervous system, right? And if you recall from before, what we've talked about is our parasympathetic system is the one that is mostly engaged during rest. It's called our rest and digest system. So, it's the one that helps us digest a lot of our foods. It also helps us to be able to slow down our heart rate and slow down our breathing. And this is what is primarily what is involved when we are at rest. This is the sympathetic nervous system. When we are needing to do exercise, or if we're in a stressful situation, we will start to increase the power of our sympathetic nervous system in order to be able to deal with whatever the crisis is at the moment. So, our sympathetic nervous system is called our fight or flight system. So, it's the one that prepares us to be able to protect ourselves, either through fighting and combating whatever is about to occur to us, or to flee from the area. So, in the sympathetic nervous system, when it's activated, we are increasing blood flow to all the major organs and to our muscles to be able to carry out the exercise of either combating what is threatening us or being able to run away from it. So a lot of times we use that example of, the saber-toothed tiger and how it's about to come out and attack us, and we need to upregulate our sympathetic nervous system to be able to deal with that. But when we're at rest, and we're calm, we're sleeping, we're just not moving our body very much. We're in a calm state, we're digesting food. Our parasympathetic system is the one that's more involved. Now, I don't want you to think of these as like two sides of the continuum. It's not like it's one or the other. In fact, what we know is that both of them are at play at all times in our bodies. It's just a matter of which one is more dominant, which one is the one that is increasing or decreasing to be able to provide us with the right stimulation in our nervous system to be able to handle the activity that's being done. Well, the main nerve that is involved with the parasympathetic system is the vagal nerve, VAGAL. So when we are about to begin exercise, we don't need to be working with our digestion system as well, right? When we're trying to run away from the saber-toothed tiger, it is not a instantaneous need to digest food. And in fact, if we push blood towards the digestion process, or it's also for the reproductive process, then we're going to actually be taking blood away from the areas that we are really needing it. So what that means is we actually will withdraw that parasympathetic activity. So we do what's called a vagal withdrawal to decrease the amount that the parasympathetic system is playing in the body. And what this does is this has our heart rate increase to about 100 beats per minute. Now, how does that exactly work? Well, our vagal nerve or our parasympathetic system, you can think of it as like a governor on a bus. So, for those of you who are familiar with like school buses have engines and everything on them, obviously, to be able to drive. However, as a protection unit, what they'll do is they'll put a governor on the engine. And what that does is it regulates how fast you can go, because we don't want kids to be going 120 miles per hour down the freeway because the bus driver decided to do that, right? So it's a protective mechanism that they put a governor on it to make it so that you cannot actually get up to those speeds. So it automatically will reduce the speeds that you're allowed to be able to go. So the way this works in our body is that this parasympathetic nervous system or this vagal nerve acts as the governor, and it says, you know what, I want to keep you at a lower amount because we don't need to be having that much activity going on. We don't need that much, we don't have that much demand on things. So when we do this parasympathetic withdrawal or this vagal withdrawal, it's like taking the governor off, and it allows us to be able to then speed up more. So we start to withdraw some of this parasympathetic nervous system just to allow us to have our heartbeat go to about 100 beats per minute. So remember, our SA node, our sinoatrial node, automatically intrinsically will beat at around 90 to 100 beats per minute. But we have hormones through our endocrine system that will actually downregulate that. And this happens also through our vagus nerve. So our normal heart rate that is trying to be at this 90 to 100 beats per minute, we have a dampener on it through the parasympathetic nervous system to make it so that we're not always beating at 100 beats per minute. This is what happens when we begin to exercise. The first thing we do is to actually withdraw that dampener. And it says, you know what? I want that SA node to intrinsically beat at around 90 to 100 beats per minute. So I'm going to go ahead and withdraw that governor or withdraw that dampener to make it so my heart rate can actually be at 100 beats per minute. When we begin exercising, that is our very first step. because it can happen instantaneously and can change beat by beat. Then what we will do is now start to activate more of our sympathetic nervous system. And this enhanced sympathetic nervous system will actually allow our heart rate to increase above the 100 beats per minute so that we can defend what our work demand is as far as oxygen demand in our bodies as we are exercising. So that's kind of how the systems work together. Beat by beat, we can withdraw that parasympathetic nervous system to get our heart rate up to the 100 beats per minute. And at the same time, we are starting to activate the sympathetic nervous system, which will then allow us to be able to increase our heart rate even above that 100 beats per minute so that we can be able to beat the blood around our cardiac output to the rest of the body to defend whatever exercise that we are doing. So the question I kind of posed a second ago is what is initiating this increase in heart rate at the onset of exercise? And how do we really know that this is happening? So we have what's called the central command hypothesis within our bodies. And this is the idea that the motor outflow, like what is being controlled from the brain going out to the rest of the body, is happening from the cerebral cortex, and it interacts with central neuron pools that can regulate our cardiovascular responses. So, when we are about to exercise, attempt exercise, begin working out, it is going, the central command hypothesis is going to increase our heart rate, increase our ventilation, increase our blood pressure, and increase our motor unit activation to lead us to be able to exercise by getting good blood flow to the rest of the muscles and being able to clear out the waste products that are produced when we are exercising and metabolizing. So this is happening as an automatic response. It's not something that we consciously do. It is happening for us all on our own. And how do we know that the central command is actually initiating these different responses? Well, there were studies that were done, and they took individuals and they had them squeeze with their hand into what's called a dynamometer, in which it means that you're just trying to do like a maximum grip with your hand, right? And hold that for as long as you could possibly do it, right? So it's a form of exercise, right? And when we do that, we are trying to increase the blood flow going to the muscles that are allowing us to be able to grip onto that handle, onto the dynamometer. So it would do it, they would have these individuals come in and they would squeeze their hand to do a maximum contraction. So they had to really focus on it. And they would measure things like heart rate and ventilation and blood pressure response and all of this to be able to figure out what's happening, right? Then they took these individuals and they injected their arm with a substance called curare, which is a local tranquilizer. And what would happen then is that in the mind, we were about to go and exercise by actually gripping this dynamometer, but our muscles wouldn't actually be able to do it because of this tranquilizer. And it's just locally acting. It's not happening within the brain, it's at the level of the muscle itself. So even though our brain was trying to grip, our arm wouldn't let it grip. And what happened is that we saw the same increase in heart rate and ventilation and blood pressure and alpha motor unit activation happening even though they couldn't actually exercise. So we knew that all of this was happening within the brain, hence the central command. It's happening within the brain and not through the appendages that are actually exercising. So our bodies, when we think we're about to exercise, will automatically start to increase this heart rate, ventilation, blood pressure, and the alpha motor unit activations to be able to handle the exercise we're about to do, even if we can't do that exercise because of whatever reason. So that's how we knew that this was happening, and it was happening within the brain and not as some sort of a result because of our hand actually moving. So we're going to take a sidestep for a moment and talk about set points. And I'm going to even take us completely away from the body and go into our houses for just a moment. So, in our houses, we have thermostats that are going to regulate the temperature of our rooms, right? And let's say I like my room to be a little bit warm, but not too hot. So, I'm going to say, like, I really want my thermostat to be set around 68 degrees. That's how warm I want my house, right? I realize some of you might not want your house that warm. I like to have a warm house. Well, what happens with the thermostat is it has a certain range it will operate around. So we might be setting it for 68 degrees, but we allow for a little bit of fluctuation in the temperature because we can't actually heat a whole entire house at exactly 68 degrees the whole entire time. So instead, it allows for a little bit of ebb and flow around this set point of 68 degrees. So we have this set point of 68, but really we can allow it to go up to about 72 degrees or down to about 64 degrees before it does something to try and change the temperature. So, what does it do to try and change that temperature? Well, if it starts to get too hot, and we're not in Oregon like I am, we actually have air conditioners, right? So, if it starts to get too hot in the house, potentially the air conditioner could turn on. It can also just stop the heater from going on, but yeah, it usually happens like right around the set point. When it gets too cold in the house and we can read that there is too cold of temperature in the house, it will actually turn the heater on. So what happens is we're trying to um, aim right around this set point and saying I want it to be 60 degrees, but if I start to drop too low in temperature, I'm going to turn that heater on, right? The heater will come on, start to increase the temperature. When I increase the temperature and it gets too hot, we can turn the fans on or the air conditioner on so it'll start to cool it. And it's going to do this until it can actually regulate right around this 68-degree mark. So here's an example of what this looked like, right? So we started, it was a little cold, so we, needed to warm up just a little bit, but then the temperature started to drop a little bit, right? And then it got really hot all of a sudden. Maybe I was working out at home or something like that. Or we had too many bodies in the home and it just increased the temperature. And it says, oh, it's way too hot, right? So I need to kind of turn on that air conditioner. But when I do that, it kind of overshoots just a little bit and the temperature got a little too cold. I opened up too many windows. And so now it starts to kick the heater back in again. And then it's trying to go right around this 68 degrees. But again, if it gets too hot, it will turn on that air conditioner. And if it gets too cold, it'll turn on that heater. Sorry. And then we go all the way until we're just trying to vacillate right around that set point of 68 degrees. So this is the way that it works in the house. Right now, let's take a look at it with our body. Our body works the same way, right? Our body temperature is normally around 98 degrees Fahrenheit. It's a typical body temperature. However, we have a little bit of fluctuation that can happen. Sometimes it's a little more, sometimes it's a little less, right? And we are wanting to operate around this body temperature of 98 degrees, but we have built-in control systems to be able to watch our temperature or our thermostat within our body to be able to change things if we start to become too hot or if we start to become too cold. So, what are these adaptations that we have? Well, if we get too hot, we can start to sweat, which can help us to release that temperature through releasing the air that is hot from the inside of the body. It opens up our sweat glands and it'll take the sweat, bring it out to the surface. And then as that exchanges into gas, that water of sweat into gas, it actually releases a lot of heat in that process. So when we become too cold, we can actually, our bodies will start to shiver, which actually increases metabolism, which will increase the heat within the system. So this works the same way. We're trying to meet right around this 98 degrees. But if I start to get too hot, I'll start to get a little bit sweaty. But then sometimes it overcorrects and I sweat too much. And then all of a sudden I start to shiver, trying to operate us right around this 98 degrees. Now, so this is our thermostat within our body. Well, sometimes what happens is we sense a threat within the body, such as we have some bacteria or some germs that are coming in, and they're a threat to the system. The only way the body, or one of the ways, let's say, that the body knows how to respond to threats in the system is to be able to roast it out, to burn it out. So if we are sensing that there's some kind of a bacteria or a virus within the body, what it will do is it will say, the only way that I know how to do this is to kill it off. One of the ways that I can kill things off is through heat, because a lot of these things don't respond well to heat. A lot of the bacteria and viruses don't respond well to heat, and they actually will end up dying off because of the increase in temperature. So, when we start to notice that we have these viruses within the body, what we can do is change the set point of what our temperature is to be at a higher point in order to try and increase our body temperature to kill off the virus that's there. So, what we do is we say, you know what, instead of operating around this 98 degrees, what I really want to do is I want to be operating like around 103 degrees, because I know if I do this, what will happen is that it will kill off anything that is trying to attack the body. Well, I was originally at 98 degrees, right? And that was our set point. But now I'm wanting to move my set point to 103 degrees, and it's sensing this gap as an error. It says, you know what? I was wanting to be at 103 degrees, but right now I'm reading at 98. So what do I need to do to get there? I need to increase my temperature. So it's reading it as if there's an error between what it wants to be at and what it should be at. And it's erring on the side of saying, I'm too cold. So what do I need to do? Well, then I start to shiver. I shiver until I can get up to this range. And then I will navigate this range here around this particular set point. So what does that look like? So I move it all the way. It goes from 98 and it'll shiver, shiver, shiver until I get up to this range. I'm hovering around the 103 degrees, right? And then when I get a little too hot, oh, that's a little too hot. So I'm going to go ahead and sweat and try to release some of that heat. But then I'm going to go ahead and I'm going to shiver because I dropped down a little bit too much. It's reading it as an error, saying I'm too cold. I need to get up to the 103. So I shivered until I could get up to the 103. But what you also notice the gap between here gets narrower as I changed my set point. So, what it means is I'm trying to keep this very tightly bound right around to the same temperature of that 103, and I'm going to regulate it more closely. Instead of allowing me 2 degrees in like down here, I have 2 degrees in temperature that I can fluctuate up to 100 or down to 96, and it's not going to be impacting me too much until I reach those. Now it's saying I'm going to change the gain of this and say that I want it to be more sensitive. So instead of allowing for 2 degrees, I'm only allowing for like 1 degree here. It's a very sensitive system. Okay, so this is the sensitivity of it, is how, what is this range from one value to the other, and that it's trying to use that set point and how much fluctuation can I have. So with a fever, we are changing it so that not only are we resetting the set point, but we're also changing the sensitivity of it so that it will actually defend more closely what that desired temperature is. Okay, so hopefully you can kind of understand how this is working within our body when it comes to temperature. However, it also does the same thing around our blood pressure. So, whatever activity we are doing or not doing, we operate with a set point. And in this set point example, it's an average of 90 millimeters of mercury. That's what the mmHg is, millimeters of mercury, and right around 90. What you'll notice is this is close together in that it is very sensitive of a system. It wants to respond quickly because if we lose blood pressure or gain blood pressure too quickly, it can cause a real havoc on our body, right? If I lose blood pressure too quickly, I will pass out. If my blood pressure goes too high, it can risk having a heart attack or a stroke. So, we need to keep it pretty closely regulated. So, it operates right around this 90 millimeters of mercury. And then it's trying to keep here, but sometimes when it goes a little too high of blood pressure, we need to compensate and instead drop that blood pressure. And then, which case, then if it gets too low, we'll need to increase the blood pressure the same way we were doing with our temperatures. But instead of regulating it through shivering and sweating or through a heater and air conditioning, this is happening through our nervous systems, our parasympathetic nervous system and our sympathetic nervous system. So I'm trying to regulate right around 90 millimeters of mercury. Whenever my blood pressure starts to get too high, I can activate my parasympathetic nervous system more. I upregulate it, increase the activity in it, and it will start to, remember, put that governor back on to the engine, or it's going to create a dampener that says, you know what, our blood pressure is too high. Let's go ahead and drop that a little bit. So it will activate that parasympathetic nervous system. And if it drops too low, and our blood pressure is too low, it says, oh no, we need to increase our blood pressure. How we do that is through the sympathetic nervous system. So we increase our sympathetic nervous activity, and then if it goes too high again, it will activate this parasympathetic nervous activity. And we're going to keep circulating around trying to maintain this blood pressure, this mean arterial pressure of around 90 millimeters of mercury. Well, this is at rest. Okay, so this is at rest, it's just trying to make us so that we can not pass out and not have any kind of an episode, and just maintaining us around this 90 millimeters of mercury. When we are about to exercise, we will change the set point of our blood pressure. So instead of it trying to be around this 90 millimeters of mercury, we will instead say with exercise, we need to defend a higher pressure, say 110 millimeters of mercury. So, what ends up happening is that if I'm starting this saying I need my millimeters of mercury to be up here at 110, but right now I'm reading down here at around 89, what I'm going to have to do is increase this sympathetic activity to be able to get up to this 110 millimeters of mercury. So I do a sudden increase in my sympathetic nervous activity, right? Until I get to the 110. Now I'm going to keep the same sensitivity around this set point. So you notice my range between my top and my bottom was not getting any smaller or larger. It's staying the same. So the sensitivity stays the same, but I'm now trying to defend this higher pressure. So I get an automatic increase in our sympathetic nervous system to bring us up to the 110. And now I'm still operating with 2 millimeters of mercury or so above and beyond. These are not exact numbers that happens. I'm just doing this for illustration purposes. So I'm trying to now operate at this higher pressure to be able to allow my body to be able to get enough oxygen around to the rest of the system to be able to maintain the exercise that we're about to do. So this is changing the set point of my blood pressure. So this is what's happening when we are activating that central command hypothesis with that cardiovascular system, right? So if this is my pressure and this is how much sympathetic nerve activity is happening, and this is like a chart going from here, as my pressure gets higher, right? If my pressure is getting higher right here, it says I don't need quite as much sympathetic activity, right? Because I need to lower it. So it starts to withdraw that sympathetic activity and increase more of the parasympathetic activity until we drop too low on our arterial pressure, and then which we're going to increase our sympathetic nerve activity. When we go to exercise, we reset this graph up and to the right in order to defend a higher pressure. But there is no change in the sensitivity of the baroreflex, which is what this is called. This is the baroreflex of being able, which I'm going to go back one picture, which is essentially this. The baroreflex says when my pressure starts to get too low, I will activate the sympathetic nervous system. When it gets too high, I will withdraw the sympathetic system and instead activate the parasympathetic system, right? So that's kind of the way that it's working. So when we change this set point, we are seeing this as a pressure error. So I was right around here in general, but my set point got changed to be up to here. So what do I need to do to get my arterial pressure to match with that? I need to increase my sympathetic activity in order to increase my heart rate and to raise my cardiac output, because that's what's going to come with it. So how does it do this? So here's where our governor is going to come into play. So whenever we are sensing that there is a drop in blood pressure, because there's either an actual drop in blood pressure, or if it's that sensing and of an error that it's too low because we changed the set point for activity, because we were about to exercise, what happens is that we are sensing this in the baroreceptors. The baroreceptors are located in the carotid arteries, which are the ones that lead up to our brain, located right in the middle of our neck, and also in the aortic arch. The aortic arch is just coming right off of the heart. These are the two larger arteries that we have within the body, and they're traveling to very important areas, right, to the rest of the body and up to the brain. So we're sensing and regulating the pressure from these areas to make sure that the body can respond in the appropriate way. So whenever we sense this drop in pressure coming from these baroreceptors, it's because there's less stretch of the arteries, and it means that there's less firing of these nerves. When there's less firing, what ends up happening is we want to start to remove the governor. So we get this opposite effect of when there's less firing going to the cardiovascular control center that's located in the brainstem, the medulla oblongata. What ends up happening is it sends messages to say we need to decrease our parasympathetic activity, which means we are decreasing the activity of that vagus nerve. By doing that, we know that we are going to end up increasing the heart rate. And remember that heart rate times stroke volume is our cardiac output. So whenever we increase our heart rate, we will increase our cardiac output. At the same time, whenever we're sensing this drop in pressure, we are not having as much stretch at the baroreceptors, which means there's less firing. It will also travel up with the message to medulla oblongata, the cardiovascular control center, and it says we need to actually activate our sympathetic nerve activity. So what does the sympathetic nerve activity do? Well, it allows us to increase our stroke volume, which also goes to add to our cardiac output. It increases our heart rate, which will lead to an increase in our cardiac output. And it allows for more vasoconstriction to be able to put more resistance on the blood pressure, which is what on the arteries, to narrow that radius or the diameter of our blood vessels, which creates more pressure, which is again blood pressure. So these are all the different ways that we can actually work to be able to have a higher heart rate, a higher stroke volume, a higher cardiac output, and a higher blood pressure. Since the parasympathetic system withdrawal can occur literally beat by beat, so as soon as we start to sense this drop in pressure, we can withdraw that vagus nerve, withdraw the parasympathetic activity in order to increase that heart rate. But the sympathetic system, mostly operating off of our hormones, takes a longer period of time for us to be able to upregulate, which means it can sometimes take around 5 to 15 seconds before it actually starts to increase our heart rate, our cardiac output, and our blood pressure. Well, we've got this timing difference between when we're starting to, know that we need to defend this pressure to when the sympathetic system can actually take full effect. And this is why we have a warm up when we're about to exercise. It allows us to start out. If I were to be sitting down, resting, relaxed, totally calm, and decide that I need to get up and run and bolt as fast as I can out of the house, most likely I am going to end up passing out. Think of it whenever you have gone from this laying position in bed after having slept for a really long time in a really relaxed state. And then all of a sudden you hop out of bed and you notice that your vision starts to go a little bit black and you get a little bit fuzzy and you almost feel like you're about to faint. That's the same thing. All of a sudden, we had a huge pressure drop. Well, maybe the pressure wasn't dropping, but at least it was sensing that it was a pressure error because I went from lying down to standing up and needing to use all of my muscles. And it made me want to pass out. So instead, we do things slowly to get the system up a little bit more naturally so that we don't end up wanting to pass out. This is where the warm up comes in, right? So I can withdraw my parasympathetic activity, but I need to start off with slower exercising to be able to make sure we're not going to pass out. And then it can actually increase our blood pressure and our heart rate and our cardiac output slower over time until I'm ready to do more intense exercise. So, when we're talking about our heart rate, the maximum amount of our heart rate, how many beats per minute we can have, declines as we get older. The traditional formula that we use to be able to calculate what our maximum heart rate would be 220 beats per minute minus your age. So if you were 20 years old, and then your maximum heart rate would be around 200 beats per minute. And this is a give or take. It's not an exact science because it's just a calculation formula. So it's usually plus or minus 10 beats per minute. But this is affecting how high our heart rate can actually get to. As we become older, we can't actually increase our heart rate as much. Other factors that can affect our maximum heart rate would be the type of exercise that we're doing. So if we're using more muscle mass, we are able to actually be able to get our heart rate up to a higher amount than if we're just doing something like a bicep curl or something like that. Diseases can also affect how high our heart rate can get. So we can have diseases in which are limiting our ability to increase our heart rate because it's affecting things that are going on with the receptors that are helping us to increase that. And then also taking some medications can actually change or factor into how high our heart rate can get. So for instance, people who are having blood pressures medications sometimes are taking beta blockers, and that's blocking those beta channels, those beta receptors that are allowing for the sympathetic nervous system to be able to work. So it regulates how fast our heart rate can go. However, during sub maximum exercise, so not at maximal exercise, but during like a lower amount of exercise at a constant workload, heart rate will begin to increase for the first 1 to 3 minutes. But then after we hit 3 minutes, it will plateau and stay at this steady state value until we increase the intensity again. If we change the intensity again, it will start to increase to match it. And it takes about a minute to 3 minutes before it hits that steady state value again. So this is also a ploy for why we need to make sure that we're warming up, because it takes a couple of minutes for us to actually be able to get the heart rate up to the response that is needed to be able to maintain that exercise. So that's what's going on with the heart rate. We also, though, have increases in stroke volume when we are moving from rest to exercise. So remember, our stroke volume was our end diastolic volume. So that's the amount of volume in the blood when the heart is at rest, minus the amount of blood that's in the heart after we've pumped, right? So that's our end systolic volume. Resting stroke volume is usually around 60 to 120 milliliters per beat in our healthy adults. That's usually how much stroke volume we will have. When we're exercising, stroke volume can reach as high as about 200 milliliters per beat in our elite athletes, but there's not a linear relationship that we can see with heart rate response. So, for instance, when we increase our workload, we will increase our heart rate, and that travels together linearly. That's not the case with stroke volume. So, stroke volume is this is minutes of exercise going across on this axis here, and this is the stroke volume that is associated with how many minutes of exercise that we're going. And this is giving you the idea of like what grade and what speed they were at on the treadmill. So they're on a treadmill here with a speed of 1.7 miles per hour with a grade. The incline is set to 10%. And then going up to a speed of 5.5 miles per hour with an incline set at around 20%. This is a specific protocol that they are doing on here called the Bruce treadmill protocol as it moves up in speed and in incline. So as we are starting to increase in the exercise and increase in the intensity, our heart rate will go up, but it starts to plateau. And this is usually right occurring around when we are halfway to our maximum oxygen consumption. So during an acute bout of exercise, we will start to plateau our increases in stroke volume right around 50% of our VO2 max or our VO2 peak, that highest amount of oxygen consumption that we can have. And it can actually even start to drop a little bit sometimes when we're at extreme intense exercise, but usually just plateaus. And then, depending on whether we are trained up here or not trained, will determine what our stroke volume can be. So, we can also start to see some chronic adaptations of stroke volume that says the more trained you are as a person, the higher your stroke volume will be in general. And it will be able to actually get to higher amounts when we are exercising, having already been trained as well. So stroke volume increases both with the chronic endurance training. So whether you are sedentary or fit or an athlete, and this is because we are building up a muscle. It's a muscle, right? The heart is a muscle and it's able to contract. And the more that we contract it, the more that we are exercising it, the stronger it becomes. And when we actually start to build up a larger size of muscle within the heart, in a good way with our left ventricular hypertrophy. So we can get the ventricles are actually starting to become stronger and bigger because we are doing this through exercise. Different than what's happening through disease, this is actually a good thing for our heart. So why is the stroke volume increasing? Well, there's a few things that are in play. Increasing the stroke volume results from being able to return more blood back to the heart through our preload, through our venous return, coming back into the heart and preloading the heart, right? So if I'm contracting more muscles, it can use my muscle pump that we have to be able to return more blood up to the heart itself and increasing the preload. Now, I also am increasing sympathetic activity, which increases the activity of the sympathetic activity to the heart, which can impact our beta receptors in the heart. And that can help us to actually have a stronger contraction of our heart. So we are increasing that contractility of the heart. Well, the more that I can increase blood flow coming into the heart and the more that I can pump out each time I contract my heart is going to increase our stroke volume. We also are decreasing the afterload, the pressure that is on the other side of our valves as our blood is leaving our heart. So, if we can decrease that pressure through exercise as well, we can also get an increase in our stroke volume. So remember, our determinants of stroke volume were the end diastolic volume minus the end systolic volume. The end diastolic volume was that venous return, and it depends on the muscle pump being able to return more blood from the extremities into the vena cava to be able to return it back into the heart. Right? The filling time, how long it takes to fill, depends on how the heart rate is, because as the heart rate increases, the filling time is reduced. So it fills it up more quickly to be able to pump it out. Our end systolic volume will depend on what was our venous return, what was our preload coming in. So, what was that end diastolic volume? And it determines because of the length of the length tension relationship with the Frank Starling, which means the more stretch that I have to the heart, the more contraction I can have. And that is limited by the pericardium. Remember that sac that we had that surrounds all of our heart only allows for so much stretch of the heart muscle because of blood filling it in. Now, as a side note and kind of a sad note, is that this is how sometimes people will get dog races to get the dogs to be able to run faster. What they'll actually go in is and do is to put a slice or a cut into the pericardium that which is limiting how much blood can fill up in the heart because it can only expand so much. And if I slice through that pericardium and I increase the ability to get more blood into the heart instead of stopping it with that fibrous pericardium that we have, it can actually increase my activity and my workload and my cardiac output because I allow for more blood to be able to come in. The hard thing is that this actually ends up sacrificing the dog because you are removing that protection from viruses and bacteria of getting into the heart as well. So I'm not saying that I should recommend this. I'm just letting you know if you've ever heard of that before, that's why it works, right? So our end systolic volume also is able to change because of the contractility of the heart. So the more contraction I can have in the heart, the more blood it's pumping out. And the less overload that I have on the other side, the less pressure I'm having to beat against, the ability for me to pump more blood out is increased as well. So I'm just reiterating those points. So our resting average cardiac output is around 5 liters per minute, which means we beat 5 liters of blood around every single minute. And on average, we have 5 liters of blood within our body. So we really beat all of our blood around in 1 minute. When we are exercising, this cardiac output can actually increase to about 20 to 40 liters per minute, depending on what your fitness level is and how much muscle mass and what your body size is. Cardiac output rises linearly with workload, just like the heart rate did. So, as the heart rate goes up, so will the cardiac output in this linear fashion, matching it because remember, cardiac output is heart rate times stroke volume. So, as the increase in heart rate happens, so does the increase in cardiac output. At around 40 to 60% of our VO2 max, any increases in cardiac output are due strictly to the increases in heart rate. Because remember, our stroke volume only increases for up to about 50% of our VO2 max. When it comes down to it, our cardiac output, our oxygen delivery, tends to be the limiting factor in highly trained athletes. In highly trained athletes, they literally just cannot pump oxygen around fast enough in their blood, and that's what will end up limiting them. It's different for somebody who is not as trained, and we'll go over that in a little bit. But it's basically they are demanding so much oxygen because of the workloads that they can do. They can't get the oxygen delivered fast enough due to this not being able to maintain a cardiac output that's quite as high as the body would demand. Now, granted, it's a lot higher than what somebody who is sedentary is able to do, but this is what the limiting factor is for them. So we're going to pause here before we move on with the rest of it, but I hope that you got something out of the video, and we will take a look in a little bit at some more factors when we begin to exercise.